So thank you very much for your kind invitation, Professor Kavinson, Professor Trofimova. Thank you very, very much. My talk is going to be for the application of gerontology medicine, peptides, in ophthalmology. And it's not only for aging, it's for people that are young and they have genetic disorders in the eyes, such as retinitis pigmentosa. Retinitis pigmentosa is a devastating disease. It's a group of genetic disorders which is inherited, either X-linked, autosomal dominant, recessive, or a sporadic event, and affects the retina's ability to respond to light. The symptoms are decreased night vision, which is ends up in night blindness, loss of sight vision, so you end up having tubular vision, and sometimes it results in blindness, and there is no cure so far. This is the normal eye, and this is the eye with retinitis pigmentosa. The left one is the visual field of a normal individual, and the right one is the visual field of somebody with tubular vision, and it could be more black and less picture. So you can see the visual field as it starts. The black is what you don't see, and the yellow is what you see. And all the other colors are relative vision. Let's start with the first case. It's a female patient, 39 years old. She's diagnosed with retinitis pigmentosa. And the visual acuity before treatment was 5 out of 10 in both eyes, which means 50% of the normal vision. And the first visit in our clinic was in February 2014. You can see how bad the visual fields are. She has just an island of vision in the middle, in both eyes. So we gave her peptides. The peptides were given to us by Professor Kavinson and Professor Trofimova. We gave them intramuscularly and then orally. So you can see how it evolved. That's the right eye, and that's the left eye. Sometimes the functional result doesn't come with the anatomic result. So sometimes you can have an anatomic problem, but the functional problem comes in the visual fields in the examination much later. So sometimes the visual field is not diagnostic. The visual acuity is what says that the patient has better vision. So, conclusively, what the peptides did, they improved the right eye and they expanded the visual fields. You can see how much black was it when they first came and how much black it was when we gave the peptides after the treatment. The visual acuity stayed the same, but the quality of life improved. And that's the left eye. So we saw in both eyes that we had stabilization of the visual acuity, and in the right eye we had an expansion of the visual fields. The second case was a male patient, 17 years old, and again diagnosed with retinitis pigmentosa. And the visual acuity before treatment was 6 out of 10 in both eyes. The first visit was in January 2014. You can see the right and the left eye respectively. The right eye, 10 days after the treatment, you can see the island of vision that has expanded, the yellow-green thing among the black and reds. And the visual field post-treatment in the right eye, 35 days from the beginning. I told you that the visual fields don't always show exactly how much the patient can see. All the patients, all of them, said that they could see more in the periphery. And that's the left eye. That started from 6 out of 10, and the visual acuity improved to 7 out of 10. When I say 6 and 7 and 8, it's not only numbers. When we see the octotype that we examine our patients, one more number says that the patient can read 5 more letters that are smaller than the previous line, which is very, very important. So you can see how the left eye is post-treatment, 35 days after the intramuscular injections and the oral peptides. So the patient received their second round. The visual acuity was 7 out of 10 in both eyes, and you can see that the visual fields improve more and more. We have more greens, more yellows, and that's the left eye. So we decided that we could give a third round of therapy, and that's the answer to your question about overdose. There is no problem with overdose, and the visual acuity is still 7 out of 10. That's the right eye, and that's the left eye, and the right eye again. And conclusively, you can see how it started. We had just a small island of vision in the center, a tubular vision, very bad quality of life, and at the end we had a very good visual field in comparison with the first one. The visual acuity before any treatment was 6 out of 10, and the visual acuity after 2 rounds of treatment was 7 out of 10. And the left eye, you can see how it evolves. As I told you, the visual fields are not always showing what's going on. And conclusively, you see that the patient had 6 out of 10, and eventually he gained 1/10 in vision, which means 7 out of 10, which is quite good. The third case is a female patient that is 64 years old. She has long been diagnosed with retinitis pigmentosa, and the right eye is legally blind. The left eye is 4 out of 10, and she first came in May 2014. You can see how black the visual fields are. She cannot see much. And the left eye can only see in the middle. So the pre-treatment visual acuity was 4 out of 10. The post-treatment visual acuity at the left eye improved. So not only we see the stabilization of the visual acuity, but you can see the improvement, because the peptides slow down the apoptosis, the cell death, but they help the photoreceptors, the photosensitive cells, to regenerate. And the fourth case, except from retinitis pigmentosa, we tried the peptides in other degenerative diseases, such as Stargardt's. It's a different disease, but it can be devastating as well. And you can see that most of the patients are 20, 30 years old. So this patient is a male patient of 33 years old. He has not retinitis pigmentosa, it's a complex disease anyway. And his visual acuity before treatment was 7 out of 10 at the right eye and 3 out of 10 in the left eye. His first visit was in October 2013. These are different visual fields. You can see that the central part is black, so he has scotomas, which is lost pixels in his visual fields in the middle, which is again a very, very big problem. If you cannot see in the center, you can imagine how bad it can be. So the visual acuity of this 33-year-old man went from 7 out of 10 to 8 out of 10. The left eye remained the same 10 days after treatment. But 20 days after the treatment, from 3 out of 10, he gained another 2 lines, 5 out of 10, which is extravagant. It's amazing. Somebody would kill for 2 lines in vision. So, the patient received a second round of therapy in February 2014, and the visual acuity was 8 out of 10 and 5 out of 10. And the 8 out of 10 became a 9 out of 10, which is 90%. Not bad. And the 5 stabilized in 5, which is also something good, because most of these degenerative diseases mean that the vision deteriorates. So that's the right eye, which started from 7 and went to 9 out of 10. And the left. So, conclusively, we had an extreme improvement of the right eye. The visual acuity before any treatment given was 7 out of 10. The visual acuity after 2 rounds of treatment was 9 out of 10. And the left eye started from 3 out of 10 and then ended up 5 out of 10. So that was the application of the peptides in ophthalmology. Thank you very much.